This is a great question. So can you see changes on mammograms after a fat transfer to the breast? The answer is yes, you definitely can. We don't see it with all patients, but we do see it with a lot of patients. Typically, oil cysts can be visible on mammograms and ultrasounds and MRIs. The number of patients that are getting fat transferred to their breasts these days just for breast reconstruction or for augmentation is so much higher than it used to be, that many radiologists are very fluent in looking at these exams and images and can tell the difference typically between something that's concerning like cancer or an oil cyst or fat necrosis or something to that effect. Sometimes this does lead to further imaging. So some patients go on to have digital mammograms done to double check, and some patients do result in having a biopsy after their initial imaging exam if there's something that does look suspicious. But typically what I tell patients is that if you are 40 years or older, you're already advised to have a mammogram. And so typically if you're anywhere close to that age, I'll have patients get a baseline mammogram so that we have something to compare to. And then after that, you would go on to get yearly mammograms anyways, and they can track those findings over time. So the answer is yes, you can definitely see changes on a mammogram, and typically radiologists can tell the difference between those benign oil cysts or fat necrosis and something more suspicious like cancer. Great question.